Hello all, I am Dr. Karthika from Department of Biomedical Engineering, SNS College of Technology, Coimbatore. Today we are going to discuss about a case study on a role of virtual reality in surgery and surgical planning. Okay, first, advancements in computing power have enabled considerable growth in virtual reality, visualization and simulation technologies. Virtual reality is defined as human-computer interface that simulate realistic environments while enabling participant interaction as a 3D digital world that accurately models actual environment. The term virtual reality was coined by Gerard Lanier. Okay. Need for virtual surgery. What is the use of this virtual surgery? In surgery, the life of the patient is of utmost importance and surgeon cannot experiment on the patient body. Many patients have lost lives because of surgical errors. VR provides a good tool to experiment the various complications arising during surgery. Okay, in virtual surgery, in general, it is a virtual reality technique and simulating surgery procedure which helps surgeons improve surgery plans and practice surgery process on 3D models. This helps the surgeon to have clear picture of the outcome of surgery. The surgeons can view the anatomy from wide range of angles. The virtual surgery is based on the patient specific model, so when the real surgery takes place, the surgeon is already familiar with all specific operations that are to be employed. And applications of virtual reality in surgery, we have training and education, surgical planning, image guidance and telesurgery. Here in training and education, traditionally the textbook images are cadavers were used for training the purpose. And VR simulators allow users to view the anatomy from a wide range of angles and fly through organs to examine bodies from inside. The experience can be highly interactive, allowing students to strip away the various layers of tissues and muscle to examine each organ separately. And while coming into surgical planning, in traditional surgery planning, the surgeon calculates various parameters and procedures for surgery from his earlier experience and imagination. This leads to a lot of errors and even to the risk of losing the life of the patients. The incorporation of the virtual reality techniques helps in reducing the errors and plans the surgery in the most reliable manner. Here the 3D reconstruction has proven particularly useful in planning stereotactic and minimally invasive neurosurgical procedures. Okay, for image guidance, the introduction of advanced imaging technology, image processing and 3D graphical capabilities has led to a great interest in image guided and computer aided surgery. Navigation in surgery relates on stereotactic principles based on the ability to locate a given point using geometric reference. It also proved useful in robotic surgery, a new technique in which the surgeon remotely manipulates robotic tool inside the patient body. Okay, while coming into telesurgery part, telesurgery allows surgeons to operate on people who are physically separated from themselves. This is usually done through robots provided with video cameras. More advanced system has been used to perform coronary anastomosis on ex vivo swine hearts and in human undergoing endoscopic coronary artery bypass grafting. Okay, in virtual surgery simulation, we have 3D simulation models. It generates a 3D model of the part of the body that undergoes surgery. Depending on the simulation needed, anatomical images can be derived from series of patients' magnetic resonance images MRI, computer tomography CT or video recording, which are 2D images. Images are segmented and constraints are imposed here. And here the image is digitally mapped onto the polygonal mesh, and VR designers are often portray that tissue as polygonal meshes that react like an array of masses connected by springs and dampers. Advances in medical graphic allows ordinary medical scan of a patient anatomy by enhancing into virtual 3D views. 3D images are color enhanced to highlight, say, bone or blood vessels, like that we have. In virtual surgery, the main component is simulator. It consists of a powerful PC which runs on the software and an interfacer haptic interface. Usually the haptic interfacer works on force feedback loop. Haptic interaction is a new field of research that adds the sense of touch to virtual environment. Some haptic devices include joysticks, keyboards and gloves that all provide the user with some kind of sensation. The addition of haptics to virtual environment has provided computer users with the ability of expression in multiple dimensions. Here we have different interfacings using virtual reality environment. Here we have human machine interaction, and we have interfacing with brain, muscles, with the help of motor commands, motion sensors, and with the help of position information and actuators, brakes. We have skin surface, contact forces, and tactile and kinematic information from the sensors. We can interact human with machine. Okay, here a human hand moves the end effector, causing the device to relay its position via sensors to the computer running on VR simulation. And in the left hand loop, forces on the end effector are detected and relayed to user's brain. Force feedback occur in real time to convey a sense of realism. The haptic device's driver card plugs into usually 500 MHz PC equipped with a standard graphic card and a regular color monitor. Here we have structure of a VR system. In this structure we have participants, displays, sensors, and we have virtual body, physical model. We also have software tools, OS communication, OS process and OS memory, and we have computing hardware for better human computer interaction with the help of VR system. And finally we have advantages and challenges. And what are the advantages of virtual surgery? Intelligent computer backup minimize the number of medical mistakes, more effective use of minimal access surgical technique, and better training in anatomy and surgical skill with reduced need of cadavers. And in challenges we have shortcomings in the realism of the simulations, cost and processing power of available hardware, need to improve human computer interface, and time delays in the simulator's response to the user movements. Thank you.